দেখছেন পেজ 1 আপনাদের সঙ্গে রয়েছে আমি সম্প্রীতি। জি 24 ঘন্টা এক্সক্লুসিভ ডক্টর কোয়েৎসি ওমিক্রনে প্রথম আক্রান্ত চিকিৎসা করেছিলেন তিনি। রোগটাকে দেখেছেন খুব কাছ থেকে। ডক্টর কোয়েৎসির পর্যবেক্ষণ কি ওমিক্রন নিয়ে?
গত কয়েকদিন ধরে কোভিডের একটা শার্প পিক, কোভিড নাম্বারস এর একটা শার্প পিক আমরা দেখেছি এবং বিশেষজ্ঞরা মনে করছেন তার পেছনে অনেকটাই দায়ী ওমিক্রন। এবং এই মুহূর্তে আমাদের সঙ্গে যিনি রয়েছেন সুদূর প্রিটোরিয়া থেকে, সাউথ আফ্রিকার থেকে, তিনি হচ্ছেন ডক্টর কোয়েৎসি, যিনি প্রথম এই পৃথিবীকে ওমিক্রন সম্পর্কে জানান এবং ওমিক্রনের অ্যালার্ম বেল বাজান। আমরা তার সাথেই এখন সরাসরি কথা বলবো। ডক্টর কোয়েৎসি, ওয়েলকাম টু জি 24 ঘন্টা again and thank you for giving us this time. First, I'll just get first to this question that you have seen the zero patient of Omicron and so far you have seen the disease throughout. So what is your finding about Omicron, if you can tell us that?
Good afternoon from Pretoria, and may your viewers have a blessed 2022. So again, we stick with the clinical pictures that we have seen. I know that a lot of the scientists doesn't want us to say that it's a mild disease. I don't know what they want us to say, but the majority of patients that you are seeing at primary healthcare level will have mild diseases. We know that the Omicron tends to get less pneumonia for patients, and the ones that are predominantly in ICU are mostly unvaccinated people. We also see that the people vaccinated that do get pneumonia are mostly the ones with, it's not a lot, it's less than, it's about 13%, but it's people with comorbidities. So it is important for people, especially over the age of 50, severely overweight, diabetes. If you think you have Omicron, go and see your doctor, get treated ASAP so that you do not progress.
Okay, some of the scientists are saying that Omicron is basically a blessing in disguise. Do you agree?
If you look at the mildest of the symptoms, and the fast way that this vaccine spread, or not the vaccine, this variant spreads. And then, yes, I think a lot of people will get nice antibodies. A lot of people will be infected without even knowing that they are infected. And going forward, that will protect them. However, how long our antibodies from natural immunity will help, it's not always sure. But the best is, if you can have natural immunity with a vaccine, that boosts your immune system tremendously. And that would be the ideal thing to do.
Okay, if we talk about the hospitalization, the severity, and especially the death rates of Omicron, comparing with Delta or the previous strains we have seen, what is your observation?
There's actually no comparison. If you look at the Delta deaths and you look at the Omicron deaths, and in Delta, we also look at the deaths that there was, deaths that was recorded during that time and not recorded whether it's Delta or whether it has anything to do with COVID. We saw a huge increase in death rate. Although, again, with Omicron, very low death rates, more or less around about 100 average. But does this mean that we are going to have a severe peak again? No, don't think so at all. I think this is the same thing that will happen in India as well. You know, once school starts to open, people go back to work out of the festive season, you will see a slight increase. But you are not there yet. You are still in where the numbers are doubling.